invite dietitian Sheryl Salis to please speak on lifestyle intervention in managing obesity and the role of various diets and exercise. I request Chairpersons Dr. Lalit and Dr. Vandana to please.
Should I start? Yeah, so good evening everyone. After Sir's introduction to the entire thing on obesity, lifestyle intervention, like Sir said, is very, very important, and I think this is the time and age, at least if I look back at my 22 years of clinical dietetics practice, I think this is the best time that we actually have a lot of patients who have faith in nutrition and are really looking at doing something to improve their lifestyle. So I think today again, thanks to technology and so much on social media and WhatsApp, people have this constant messaging that they keep doing, or they're Googling on Google to see which diet is really good for weight loss, and there are thousands of diets that are there emerging, and if you see, there are so many that you can do one new diet every day. And in the past we had only the GM diet, and today you have so many new diets, and people often fall prey to this because they promise quick fixes. It's available on the internet, they're extreme diets, they're celebrity endorsed, and most importantly is they're free. Again, there's so much of confusion in the person's mind that which one should we follow. A lot of people go off gluten because they think that will help them lose weight. Some people follow the ketogenic diet, then we have intermittent fasting, and so on and so forth. Now, this is what we actually see, and I think for every dietitian or any healthcare professional, seeing our person lose weight and then gain all the weight that is lost is something that we're not very proud of. So weight loss is easy, weight maintenance is always a challenge, and I think it should be our endeavor to help patients maintain the lost weight. And also when they go and do such kind of crash diets, there are nutritional deficiencies that arise out of these diets, and often they end up with malnutrition or hidden hunger. Now there are many, many guidelines which are out there which are talking about, obesity management and its role in lifestyle, and the role of lifestyle interventions. Now in summary, everybody agrees that you have to do a reduced caloric intake. I think very important is to reduce the amount of calories that we are consuming, at least achieving a 500 to 750 kilocalorie deficit. It has to be based on personal and cultural preferences, especially I think this makes very true in our country where we have such a diverse population, where North eats so differently to the West and West eats very differently to the East and then the South. And again, meal plans that include the Mediterranean diet, the DASH diet, low carb, low fat. Again, there are different kinds of diets, and again, if you're looking at achieving, less than 5%, if you're trying to achieve more than 5% of weight loss, short term, very low calorie diets, are very important is they should be supervised and prescribed by a qualified professional. Meal replacements may be utilized. Again, physical activity, and I'm sure you also in your clinical practice see that people are very, very rigid to doing physical activity. Physical activity is very negligible. They have many, many reasons why they can't do it. Often they say we spend a lot of time commuting to work, we can't really take out time, there's a lot of pressure at work, and there are so forth and so many more reasons. And again, we're looking at behavior modification. Motivation for long-term adherence is very important. Avoiding stigmatization, aim for 5 to 10% of weight loss. And again, we always tell the person, because everybody is trying to come to that ideal body weight, and even if you look at all the guidelines, they suggest that there is no ideal body weight. We are looking at the right weight. We are looking at adiposity versus obesity, and therefore looking at waist to height ratio, waist to hip ratio, waist circumference, and body composition. Focusing on lowering the visceral fat becomes extremely important. Avoiding weight cycling, that is to yo-yo diets. And again, very important is to provide long-term counseling support to these individuals, and monitoring the body fat, the body composition, monitor the waist circumference as well as the body weight. This is again very important, and the ADA again suggests high frequency of counseling, at least more than 16 sessions over 6 months, and very, very important, it has to be individualized. It's not a one size fits all. And therefore, we are looking at not only BMI, but we are looking at adiposity, and that's why body composition, waist circumference, waist to height ratio, these become very, very important. And this is what we focus in our clinical practice, because people get very demotivated when they don't lose weight, and then they go back to their unhealthy eating practices. We have to tell them that weight is not the only criteria, and they have to look at a lot of other things. These are the recently released ESI guidelines. These are as recent as last month, and again, the guidelines are very, very clear in terms of, and very specific to India, where they're talking about the goals of obesity management are to keep the patient metabolically healthy, managing the comorbidities, restoring the self-esteem, positive body image, and avoiding stigmatization. Weight loss, again, they agree, should not be the only goal. Weight loss is targeted toward reducing the cardiometabolic risk factors and associated comorbidities, and again, trying to achieve a 5 to 15% weight loss. Medium and long-term goals should be, and again, they should be SMART goals. Again, when you're looking at weight loss, what is the kind of expected outcome? So we're looking at least a 5 to 15% weight loss, resulting in reduction in all the comorbid conditions as well. Again, they've very clearly given guidelines in terms of if its person is overweight, we're looking at lifestyle interventions and then moving on to pharmacotherapy and then bariatric surgery. Now, this is where the nutrition aspect comes, where we are looking at Indians, and we know we are a carb-loving country. 65 to 70% of our calories come from carb, whether it's breakfast, lunch. Evening snack is becoming a big concern, and people often snack on a packet of biscuits or some bhujia. Late night snacking has also crept in because people are coming home late and then sitting and binging on Netflix, eating a lot of unhealthy food, and as a result of which a lot of carbs, a lot of calories intake has come in, and therefore looking at moderating carbs in our Indian population, reducing the amount of simple carbs, improving the amount of complex carbs, lente carbs, resistant starch, increasing the amount of fiber in the diet is very, very important. Again, choosing low glycemic index, low glycemic load foods, and sticking to our Indian traditional diets. And if you ask me, I think this is the most well-balanced diet with all the nutrients, and nutritional deficiencies will not arise out of such a diet. Protein, again, is a nutrient of concern in our country, and therefore it is very important to educate our patients on the protein sources, adding protein to every meal because that gives them satiety, and looking at also economical sources of protein, and therefore trying to at least come to around 15 to 20% of calories coming from protein. Now, where fat was considered a villain in the past, today where we are moderating the carbs, again, including good quality fats in the form of MUFA fats, omega-3 fats, reducing on saturated fats and negligible trans fats is again very important. If you look at our packet of biscuits, we're talking about reducing saturated fats, but all packaged foods have got saturated fat content, it has got your sodium, and all of that should be discouraged. And maybe we should give our patients options in what they can carry with them when it's to work, or maybe even when traveling, which is easy to carry, as well as it's taking care of the calorie content as well as the carb, protein, and fat content. Ensuring that the diet is having enough of diversity, ensuring nutrient density by getting the right amount of micronutrients in the diet, incorporating a lot of fresh fruits, vegetables rather than canned fruit and fruit juices. The plate method is again, which is something which is very simple for us to explain to the person. Take a small plate, that is a 9-inch plate, fill half the plate with non-starchy vegetables, 1/4 of our plate with cereals, millets, and starchy vegetables, and 1/4 of our plate with protein-rich foods. Just by doing this, we are going to moderate the carbs, improve the nutrient density, increase the diet diversity, improve the quality and quantity of protein, as well as get the much needed fiber into the diet. This becomes easy to even implement on a household level, because when we're looking at obesity, it should be that the entire family should be able to adapt to this whole thing. Again, very important is to look at culinary science, bring back the joy of eating in the person's life, because often when people are on a diet, and honestly I'll tell you, when they come to my clinic, they sometimes even reschedule the appointment because they want to go for a buffet dinner, or they'll have 2 samosas or 2 vada pavs and then come to us because they feel abhi ye ghas poos khilane wali hai. They have this perception that a dietitian means she's going to stop all our food, and that's not really true. I think the whole thing is getting back the joy of eating into their life, giving them the right concepts which can be sustained and which they also enjoy. Mindful and slow eating. I think this is again very important because people are watching the television and eating. They really do not realize how much they're eating, or they're on their phone answering emails, and therefore they do not really realize how much they're eating, and the satiety center is not reached. So again, mindful eating is the new mantra, and we should try and encourage them to do that. Maintaining a food diary or even messaging. I think for us dietitians, they all send us their food pictures. We often see them sometimes on the next table taking pictures of their meals and sending us. And this has become again for us easy because we can actually look at portion sizes, but they have to be honest in reporting. I think very, very important, because we tell them it's not that you're cheating us, you're cheating yourself. So be very honest in reporting and giving them, options. Eating disorders is definitely a big concern that we are seeing. And also that when we plan a diet, we're also looking at other comorbid conditions such as hyperuricemia, dyslipidemia, hypertension, etc. And there's a lot of myths around uric acid. A lot of people just stop eating protein completely. And we know that it is not only protein which is the culprit. Again, we're looking at meal replacers. Last slide. Meal replacers, again, there is an indication of use of meal replacers, but honestly, if I tell you, in my practice, I've not been really successful in getting people to change all their meals to meal replacers. Like just drinking those liquids 3 times a day, we're not really getting those results. We really need very highly motivated individuals. But where we've seen success is partial meal replacement, where we replace one meal and usually a snack, that evening snack, if we can replace by a meal replacer, we've seen a fair, compliance over there, and also a person is more ready. Again, activity. I think this is something that we're all harping on. People only want to zip the lip. They don't want to move the hip. And the focus should be also about trying to move. So sit less, move more. As we say, sitting is the new smoking. Try and encourage physical activity and make it fun. Again, bring in the fun element. And I think today, thanks to, there are so many classes which are there, or even online, they can do different kinds of activities. So we're looking at least 300 minutes of aerobic physical activity of moderate intensity and 150 minutes a week of vigorous intense activity. Again, bringing in strength training, because that is something people really don't do. So functional training, strength training, yoga, meditation, breathing exercises. Again, these are very, very important things, and slow and steady. Again, we can't tell them to do 1 hour on day 1, because they do it and then next day they're again back to the beds. They don't really do activity. So slow and steady. What we really start with is at least 10 minutes post meal every day. So even if they do 30 minutes of that, that is fair enough. And then step it up. We always tell them, find a good exercise buddy who can, you enjoy going with, who will motivate you to work out. And again, try and be as physical activity. So every half an hour, get up from your seat, walk a little, and then come back. So find reasons to move. And I think that itself can do the magic, because if we want to sustain the weight loss, physical activity becomes a very, very important component, and it should become a habit. So in summary, reduce caloric intake, increase physical activity. Again, behavior, sleep. I think sleep is something which is very, very important. Stress management and medication or surgery when indicated. So thank you so much for your patient hearing.
Next talk, I request Dr.